welcome to SVG-TV News for Monday, March 30th, 2020. I am Yvette Bowens with the details. All ports of entry in the Grenadines have been closed for yachts and other vessels until further notice. A release from the Office of the Prime Minister said the order to close the ports of entry at Union Island, Canouan, Bequia and Mustique, which was later added, was taken on the advice of the Commander of the Coast Guard Service. The order came into effect from 7 p.m. on Friday, March 27, 2020. Larissa Pugzikid tells us more in this report. There are also social or physical distancing guidelines which omnibus operators are advised to conform to, and revised regulations for patient visits at the Milton Cato Memorial Hospital.
A release issued by the Office of the Prime Minister, the decision taken to close the ports of entry at Union Island, Canouan, Bequia and Mustique, which was added a day later, was taken to focus the state's resources on better border security. The release said 4 incidents on Friday, March 27th, prompted the decision on temporary closure of these ports of entry to yachts and other vessels. As a consequence of the closure of 4 ports of entry in the Grenadines, following upon an earlier closure of the Chateaubriand port of entry, all yachts are required to enter at one of 3 ports on St. Vincent, namely Kingstown, Blue Lagoon and Wallalaboo. All owners, operators, crew and passengers of yachts have been urged to cooperate with the state authorities, with a warning that if there is any attempt to circumvent the integrity and laws of St. Vincent and the Grenadines, especially at a time of COVID-19, the government will take further action promptly. As for omnibus operators, they are being asked to conform to the social physical distancing guidelines by allowing only 1 person to sit in the front passenger seat and no more than 3 persons on the other seats. At the country's main hospital, revised regulations for patient visits have been put in place effective today, Monday, March 30th. The revised regulations are as follows. Group visits are no longer permitted at the hospital and only 10 minutes will be allowed per visit. The new visiting hours is now from 3 to 5 p.m. The 11 to 12 noon visit hour slot has been removed. No more than 2 persons will be permitted to see a patient at any one time on the general adult wards or on the pediatric ward, and 1 person will be allowed to visit at the maternity B ward. The visitors would be required to state the name and the ward for the patient he/she would like to visit. Visitors must present a picture ID at the security booth. The ID would be kept and the visitor pass will be issued to persons granted entry. The ID would be returned on exit and the pass surrendered. Patients requiring entry to the facility for the purpose of accessing other services will be expected to show supporting documentation, example, prescription, appointment cards, hospital bill, forms for procedure, etc. Personal supplies for loved ones must be brought within visiting hours. Persons who are ill or who may have been exposed to persons infected with COVID-19 are asked not to visit the hospital, and persons who have been in SVG for less than 14 days are asked not to visit the hospital. The Ministry of Health, Wellness and the Environment said these regulations have been updated at a time when the world is facing a coronavirus pandemic, and that the safety of patients, staff and the public is a top priority. For SVG-TV News, Larissa Pugzikid.
With the country's airports still open, mandatory quarantine is now in full effect and is being enforced by the Royal SVG Police Force and public health officials. This is according to Health Minister Luke Brown, who said that they had to secure court orders for all of the passengers who came into the country on American Airlines Flight 1427 on Saturday.
About 80 persons came in on the American Airlines flight on Saturday, and they are all in self-quarantine. The self-quarantine is a mandatory requirement, and guidelines for self-quarantine have been issued, and the stipulations, there are certain stipulations which have come with it, because those passengers were served with court orders. They were also required to surrender travel documents, and they will be monitored, and they signed a bond as well, and they're going to be monitored by public health officials working in collaboration with the police force.
Brown admitted that they have experienced reluctance by some persons who refuse to comply with the quarantine measures, and that while they are doing their best in this regard, they are now asking members of the public to report anyone who may not be following the rules.
Strictly enforce the requirements, and we have the force of law as well, to which there could be recourse. Of course, non-compliance could lead to fines, and it could also lead to imprisonment. And we're just encouraging the public to assist as well with the monitoring of persons who should be in self-quarantine. And if you are aware of any breach in that respect, you could call the COVID-19 hotline, for instance, at 534-4325, or you could otherwise have it reported to the Ministry of Health or to the police, and it will promptly be investigated and a determination will be made. Actions will be taken because we are very serious about protecting the health of Vincentians.
More than 10 countries are on the list that persons traveling from to SVG must undergo a 14-day mandatory quarantine. They are the United States of America, including the U.S. Virgin Islands and Puerto Rico, Canada, the United Kingdom, China, Iran, South Korea, the European Union, including Italy, and overseas departments of France, such as Guadeloupe, Martinique, Saint Martin, and French Guiana. Further, those persons who meet the quarantine requirements will be required to sign an undertaking quarantine form issued by the Ministry of National Security, Air and Seaport Development. Any breach of this undertaking is expected to result in appropriate action under the laws of SVG. The month of April is expected to bring with it positive developments as it relates to this country's fight against the coronavirus. This is according to Minister of Health, Wellness and the Environment, Luke Brown, in an address to the nation on Friday night. Testing is key in the fight against COVID-19, with all testing for SVG being done externally, either at the Caribbean Public Health Agency, CARPHA, or at Best Dos Santos Laboratory in Barbados. The health minister said SVG should be able to begin its own testing by April 6th.
Target date for the commencement of this phase of testing is April 6, 2020. The necessary equipment and supplies have already been ordered and should be in country by next Friday, subject to delivery arrangements holding up at a time of supply chain disruptions. We have already identified a testing site away from the lab itself because of space requirements, and we've also lined up training for laboratory personnel. The capital cost associated with the development of our testing capacity is roughly $300,000. By the way, I saw a recent article which stated that the Food and Drug Administration has authorized the first rapid point-of-care coronavirus test. This is a promising development with the potential to substantially alter the dynamics of this pandemic.
Healthcare personnel are on the front lines in the fight against COVID-19, and manpower is key at this time. Minister Brown said a brigade of Cuban medical personnel are already in the state, and the isolation center at Argyle is expected to be completed in April.
A Cuban brigade consisting 4 doctors and 12 nurses arrived in St. Vincent and the Grenadines last night. The members of the brigade are specialists in the control and management of infectious diseases and will work at our isolation center. They would also assist with additional and ongoing training for local staff. The brigade is expected to be here for 3 months in the first instance, subject to renewal. It is not necessary for the Cubans to be in quarantine because they spent 14 days in quarantine in Cuba before embarking on the journey to St. Vincent and the Grenadines. 3. The isolation center. The work on the isolation center is progressing well and is on track for completion by mid-April. The total projected costs, which includes property purchase, construction, equipment, and supplies, is about $3.8 million. The NIS is helping out with a donation of $750,000.
Minister Brown said the number of ICU beds and ventilators are also expected to increase soon.
Able to treat the 5 to 6% of cases that may require ICU beds or ventilators. The ministry is increasing the number of ICU beds available for treatment of COVID-19 patients, as well as the stock of ventilators in the health system. This is mission critical. Currently, we have up to 13 ICU beds and 6 ventilators in the health system. We are raising these numbers to 43 ICU beds and at least 26 ventilators. Vaccine and treatment. The public is reminded that there is neither vaccine nor specific antiviral treatment for COVID-19. The research in these areas is ongoing. We expect breakthroughs. In the meantime, St. Vincent and the Grenadines has purchased the Cuban drug interferon, which has been used to good effect in the treatment of COVID-19 cases in China and elsewhere.
The government is said to have agreed to subsidize omnibus operators, provide sanitizing items, and withhold outstanding bank loans for a short time. This is according to Vice President of the Vincentian Transport Association, previously known as NOBA, Angus Mackey, who told SVG-TV News that these incentives were agreed upon during a meeting today with the Prime Minister, Dr. Ralph Gonsalves. Mackey said he is pleased with the agreement, which will benefit all van operators and passengers. He said the subsidized amount will be announced by the Prime Minister.
He decided that he would fund that aspect of it. He would get in contact with the Ministry of Health and organize some persons to sanitize. So we would designate some sanitization stations. I think most unlikely would be in the bus terminal, and probably 2-3 times a day he would sanitize each bus. And the other matter of the 3 passengers on a seat, he decided that he would also give the guys a subsidy as well. We haven't finalized on the number, like the amount he going to give, but we were in a ballpark of a certain figure as well.
Mackey further spoke of the agreed provisions for bank loan payments for the omnibus operators.
The loans at the banks and stuff like that, like those van drivers who have loans at the banks, also, they would be able to write the banks, and they wouldn't have to incur any interest on the loans. No, they wouldn't have to pay the principal for the loan for at least a 3-month period, but they would have to put it in writing and submit it to the bank. That was also something that he said, you know, that was one of the things that he did for them, transportation-wise, yeah.
Passengers have also been encouraged to do their part to ensure the van operators comply with the 3 persons per seat guideline.
To have some sort of compassion and understand that the government could actually go to budget, speed up a lot, and put a line to place and put the vans in to carry a certain amount of passenger, right?
Okay.
It's either they want to, you know, get done the hard way or the soft way. I think the soft way is the easiest way, because if it becomes a law, it would be hard to reverse it after the whole COVID-19 has already come and passed. So for the time being, because of the safety of the public, I think that you know, they would comply, because it's in the interest and the own detriment of them and the public. If they don't want to adhere, the public do their part in it. If the public stop a van and they see the van already had 300 seats and they are trying to push them in any German position, don't go into the van and wait for the other van that thing. And also, John, Superintendent John for traffic,
Okay.
I also spoke to him, and he would be assisting with the making sure that the vans adhere to the staff rules that are in place right now.
SVG stands to benefit from $1.7 million as part of the Caribbean COVID-19 Response Fund provided by the U.S. government to assist countries in the region scale up their risk communication efforts and manage COVID-19 cases. This support from the U.S. government builds upon decades of U.S. investment in the Caribbean, including more than U.S. $236 million in health assistance over the past 20 years. The U.S. government is leading the world's humanitarian and health assistance in the face of the COVID-19 pandemic. The State Department and USAID are providing an initial investment of nearly U.S. $274 million in emergency health and humanitarian assistance to help countries in need, on top of the funding already provided to multilateral organizations such as the World Health Organization and UNICEF. This assistance is part of a larger U.S. government global response package across multiple departments and agencies, including the Centers for Disease Control and Prevention. The United States continues to be the single largest health and humanitarian donor for both long-term development and capacity-building efforts with partners and emergency response efforts in the face of recurrent crises. The Republic of China on Taiwan, through its embassy today, donated a number of medical supplies to the Ministry of Health to help with the country's fight against the spread of the coronavirus. The items include gloves, hand sanitizers, nebulizers, and face masks. At a handing-over ceremony, Minister of Health and Wellness and the Environment, Minister Luke Brown, said he appreciates the continuous support from the government and people of Taiwan to SVG.
Basically, building up the stockpiles so that if there should be an escalation of the problems associated with COVID-19 in St. Vincent and the Grenadines, we are ready to deal with that escalation. And we are all the more prepared to deal with it because of friends like the Republic of China on Taiwan, and I'd just like to thank them again for what they've done for us in the past, what they're doing now with this handover today, and what we could expect from them in the future. You recognize that they have marked themselves out as exemplary in respect of the way they have been able to contain the number of cases in their country. Even while they were basically just a stone's throw away from the initial epicenter, the place where from which there was the outbreak of this disease, yet they were able to keep things under control reasonably well.
A mid-Sunday afternoon shooting incident has left 34-year-old Marlon John of Fairburn Pasture dead and Esley Martin of the same address nursing a gunshot wound to his leg. The shooting incident took place between 4 till 5 p.m. on Sunday, March 29th at Mama's Corner, a popular liquor and grocery shop at Fairburn Pasture. This is the 5th homicide recorded in St. Vincent and the Grenadines for 2020. The deceased was a laborer who lived with his father in Fairburn Pasture for 3 years after the passing of his mother. The father of the deceased told our news team that he was on his porch fixing his doorknob when his son left the yard to go by the shop, and hours after he heard gunshots ring out.
I there fixing his door, and I left him. I mean, he been here and he go where? He go up the road. They must have been up the cooking, I really don't know, you know. And then after, I only hear, pow, pow. Hey, me lad, I wonder what happened, boy. But I know he up the road, eh. Then after, I used to go and right this one. I stand up by the wall. Then somebody calling me. Me say, for what? I say, Marlon call me. Let me go up there. Marlon, brother. Yeah, so most times I don't really know where you went on. There's a 2 gunmen come up there and shoot them. Shoot 2 of them, I know.
John said by the time he arrived at the hospital, his son was already dead. Breaking down in tears, the distraught father said he will miss his son, who was very helpful around the home.
Well, everybody know Marlon. Marlon got a kind of half-hasty attitude. But after that, it was no problem to me. It's life. So person live, so they would die. Both of us. Marlon, I live with the mother because my mother died about 3 years, going 3 years ago. The 25th of next month will be 3 years. But most time, when Marlon, they up the road and down the road, that's all me know much about here. Okay. It was no problem for me anyhow.
The SVG Coast Guard Service has reported 18 successful search and rescue missions in the country's territorial waters for the first quarter of this year. In a news release, the Coast Guard Service says these operations have resulted in the saving of 34 lives, comprising of 16 nationals and 18 non-nationals. The non-nationals included 2 British, 1 Guyanese, 2 Barbadians, 4 St. Lucians, and 9 Grenadians. Among search and rescue missions was the rescuing of 2 British citizens on the 23rd of March 2020 According to information provided, the Coast Guard received a distress message from the International Maritime Rescue Coordination Center via Trinidad and Tobago's Rescue Coordination Center. The report was related to a sailing vessel named Nemo that was located at latitude 13 degrees north and longitude 62 degrees west, approximately 62 nautical miles west of West Key, Bequia, with a broken rudder. Coast Guard vessel Captain Hugh Mulzer was deployed in response to the distress report under the command of Lieutenant Commander Enos Hamlet and crew. The vessel Nemo was located at 65 nautical miles west of Bequia and was taken into tow. Almost 24 hours later, on Tuesday morning, March 24th, the distressed vessel was secured in the Villa area. In addition, during the first quarter of 2020, the SVG Coast Guard Service is said to have conducted 16 medical evacuations from the Grenadines. The SVG Coast Guard Service was established on December 2nd, 1980. Its motto is dedicated to saving lives. According to Commander Brenton Kane, the SVG Coast Guard has been living up to its motto in a subtle but effective way over the years and will continue to patrol the waters of SVG on a regular basis to ensure the safety of locals and visitors alike.